There is a food sitting in your refrigerator right now that costs less than $1, has been part of human breakfast for thousands of years, and is either quietly helping you manage your blood sugar or silently making things worse. And here is the part that is going to surprise you. It is not about whether you eat eggs. Most people with diabetes have already decided where they stand on eggs. Some eat them every morning. Some gave them up years ago on a doctor's advice. But almost nobody has been told the truth about what actually determines whether eggs work for them or against them. And that truth comes down to a very specific set of decisions. Decisions so small, so easy to overlook, that most people make them without thinking twice. Those decisions can mean the difference between a fasting blood sugar of 165 every morning and a fasting blood sugar of 130. Same egg. Completely different outcome. I am Dr. Raj Patel, 15 years in clinical practice working at the intersection of nutrition, aging, and metabolic health for adults over 60 managing diabetes. Today, I want to have a straight-talking conversation about eggs, not the version filled with outdated fears and old myths, the version backed by current science and real outcomes I have seen in real patients. Stay with me to the end, because I am going to share something about egg timing and your body's morning hormone cycle that almost nobody talks about. When you understand it, the way you approach breakfast will not be the same again. Before we get into the practical details, I want to clear up the single biggest misunderstanding I see about type 2 diabetes. Because without understanding this, none of what follows will make complete sense. Most people assume type 2 diabetes means the body cannot produce enough insulin, and for some people in the later stages that is partially true. But for the vast majority of adults managing type 2 diabetes, the deeper problem is something different. The body is producing insulin. Sometimes it is producing more than normal, but the cells in your muscles, your liver, and your fat tissue have stopped responding to it properly. They have become resistant to the signal. Your body is sending the message. The cells have turned down the volume. Why does this matter for eggs specifically? Because what you eat for breakfast, particularly how much protein you consume alongside carbohydrates, has a direct and measurable effect on how sensitive your cells remain to insulin for the rest of the day. This is not a minor detail. This is the mechanism that determines whether your blood sugar stays relatively flat after a meal or spikes sharply and stays elevated. High-quality protein in the morning works in two specific ways. First, it slows gastric emptying. Food moves more slowly from your stomach into your small intestine, which means glucose enters your bloodstream as a controlled drip rather than a sudden flood. Second, certain amino acids in protein, particularly leucine, which eggs are exceptionally rich in DHA, stimulate the pancreas to release insulin in a more timely and proportionate way. Your insulin response becomes more precise, less chaotic, more effective. 2 large eggs contain 12 to 13 grams of complete high-quality protein. Complete meaning all 9 essential amino acids your body cannot produce on its own, and their glycemic index is essentially 0. Eggs do not raise blood sugar by themselves, not by a single point. But that 0 only stays at 0 if you handle them correctly. The moment you fry them in butter, stack them on white toast, or wash them down with a glass of juice, that protective power begins to erode. Not because the egg changed, because everything surrounding it did. I know what some of you are thinking right now, because I hear it in my clinic regularly. You were told, probably by a doctor 10 or 15 years ago, that eggs raise your cholesterol and are dangerous for your heart. And if you are living with diabetes, which already increases cardiovascular risk, you took that advice seriously. You gave up eggs. You switched to oatmeal and fruit. You thought you were making the responsible choice. Here is what the science now tells us. For the vast majority of adults, including most people with type 2 diabetes, dietary cholesterol, the cholesterol you eat in foods like eggs, has a minimal effect on your blood cholesterol levels. The bigger drivers of harmful LDL cholesterol are refined carbohydrates, added sugars, and trans fats, not eggs. Research published in the American Journal of Clinical Nutrition found that whole egg consumption improved what scientists call cholesterol efflux capacity, the ability of your good HDL cholesterol to actively remove harmful cholesterol from your artery walls and carry it out of your body. And a 2025 randomized controlled trial from the same journal found that when 2 eggs per day were eaten as part of a diet low in saturated fat, LDL cholesterol actually decreased compared to a high saturated fat diet without eggs. The problem was never the egg sitting in your refrigerator. The problem was what we were cooking it in and what we were eating alongside it. The egg you gave up may have been your ally all along. I want to tell you about Aaron, 71 years old, managing type 2 diabetes for nearly a decade, sharp, disciplined, and genuinely committed to doing everything right. But his A1C had been stuck at 8.0% for 2 years, and his fasting blood sugar rarely dipped below 158 despite his medications. When I asked him to walk me through his daily routine, he described his breakfast with quiet pride. Steel-cut oatmeal with a tablespoon of honey and half a cup of blueberries. A glass of cranberry juice he bought from the health food store because the label said no added sugar, sometimes a small whole wheat muffin he baked himself. He genuinely believed this was a responsible diabetes-friendly breakfast. I asked him to do one thing: check his blood sugar at 45 minutes after eating and again at 90 minutes. He came back the following week with his log. At 45 minutes, 214. At 90 minutes, 198. Every single morning that breakfast was sending his blood sugar past 200. The steel-cut oatmeal, despite its wholesome reputation, was breaking down into glucose quickly in the absence of meaningful protein. The honey was adding pure, simple sugar. The cranberry juice, labeled no added sugar, still contained 24 grams of naturally occurring sugar per cup with 0 fiber to slow it down. The whole wheat muffin was delivering another rapid carbohydrate load. His body was working overtime every morning before 8 a.m. I proposed one foundational shift: 2 eggs cooked without oil paired with half an avocado and a generous handful of sautéed spinach. Same medications, same walks, same everything else, just a different breakfast. 3 weeks later, Aaron came back and pulled out his glucose log without me even asking. His 45-minute reading was now averaging 138. His 90-minute reading was averaging 124. 4 months after that, his fasting blood sugar had dropped to an average of 131, and his A1C came down to 7.3%. He sat across from me and said, "I feel like someone finally turned on a light in a room I have been trying to navigate in the dark for years." The solution was always in his refrigerator. Knowing that eggs are beneficial is step 1. How you prepare and pair them determines whether you actually experience that benefit. Let me go through this directly. The gold standard for blood sugar management is eggs cooked without added fat. I know that sounds counterintuitive. We have always associated eggs with butter or oil in the pan, but egg yolks already contain their own natural fat. 2 beaten eggs in a non-stick pan over medium heat will cook beautifully in 2 to 3 minutes with 0 added oil. Creamy, soft scrambled eggs with nothing to complicate the metabolic picture. Boiled eggs are equally excellent, and I recommend them specifically for anyone who wants convenience. Hard boil a batch of 6 on Sunday evening. They keep perfectly in the refrigerator for 5 to 7 days. Peel 1 or 2 in the morning, pair them with your vegetables and avocado, and your entire breakfast takes 4 minutes. Poached eggs are a wonderful option as well. No oil whatsoever, just water with a small splash of vinegar to help the white hold together. What you want to avoid is frying in oil or butter. Some of you are thinking, "Wait, but I use olive oil, is that not healthy?" Olive oil is genuinely valuable food, but its benefits are greatest when consumed cold or at low temperatures. When you heat it to frying temperatures, you diminish those benefits and add a fat load that in the context of diabetes can temporarily worsen insulin resistance at the cellular level. Save your olive oil for salads and drizzling over vegetables where it actually does what you want it to do. This is where the real difference is made. or where people unknowingly undo everything the egg was doing for them. Avocado is the single best companion for eggs in a diabetes-conscious breakfast. The monounsaturated fats in avocado slow digestion and reduce the glycemic impact of everything else you are eating alongside it. They also support heart health, which matters enormously for anyone managing diabetes. Half a ripe avocado with 2 eggs is a combination that is filling, nutritious, and genuinely stabilizing to blood sugar. Spinach deserves a specific mention. It is one of the richest dietary sources of magnesium. Research consistently shows that people with type 2 diabetes have lower magnesium levels than those without, and low magnesium is directly associated with poor insulin sensitivity. Eating spinach regularly, especially alongside a protein-rich meal, is one of the simplest ways to address that gap without a supplement. Tomatoes, bell peppers, onions, mushrooms, all excellent additions. Low carbohydrate, high fiber, they increase the volume and nutrition of your meal without pushing blood sugar up. What to avoid pairing: white bread, flour tortillas, sweet biscuits, hash browns, sugary ketchup, orange juice, and processed deli meats like bacon or sausage. These pairings feel like what naturally goes with eggs, but every single one either spikes blood sugar directly or adds inflammation, promoting saturated fat and sodium that works directly against you. Drop your current fasting blood sugar number in the comments below. Just the number. I read every single one, and it helps me understand exactly where this community is starting, so I can keep making videos that actually meet you where you are. Now, the concept I promised you at the start, the one almost nobody talks about, and the one that ties everything else together, it is called the dawn phenomenon. In the hours just before you wake up, your body releases a wave of hormones, cortisol, glucagon, growth hormone, as part of its natural preparation to get you out of bed and functioning. One direct effect of these hormones is that your liver begins releasing stored glucose into your bloodstream, raising your blood sugar before you have eaten a single thing. For people without diabetes, the body quietly produces a little more insulin and handles it. For people with type 2 diabetes, that early morning glucose release can push fasting numbers significantly higher than they were at midnight. This is why so many of you check your blood sugar first thing in the morning and find a number that makes no sense given that you have not eaten in 8 hours. Here is the critical connection to eggs. What you eat for breakfast either amplifies or dampens this morning cortisol glucose cycle for the rest of the day. A high carbohydrate breakfast layers another glucose load directly on top of the one your liver already delivered. That is what was happening to Aaron every single morning. A high-protein breakfast, eggs being the centerpiece, sends a calming signal to your metabolic system. It feeds your muscles without triggering additional insulin surges, and it dampens the inflammatory response that cortisol can set in motion. The practical implication is simple. Eat your eggs within 30 to 60 minutes of waking up. Do not let that morning cortisol window run unchecked. Give your body protein early, and your blood sugar curve for the rest of the day will be measurably flatter. Now I want to introduce you to Joe, 66 years old, retired. Fasting blood sugar consistently between 145 and 165, despite reasonably good daytime control. Joe was already eating eggs for breakfast, good start, but his dinner every night was a heavy carbohydrate meal, rice, pasta, or bread, and around 9 p.m. he would have a small bowl of cereal because he was slightly hungry before bed. Here is what was happening overnight. When you eat a significant carbohydrate load in the evening, your liver has an abundance of glucose to work with, and in the early morning hours, it tends to over-release stored glucose as a result. The dawn phenomenon was hitting Joe harder than it needed to because he was giving his liver too much to work with overnight. I introduced what I call the evening egg strategy. 2 egg omelet packed with vegetables, spinach, peppers, mushrooms, whatever he had, with a small green salad on the side. No bread, no rice, just eggs and vegetables. 3 nights per week. That was all I asked. 3 weeks later, his average fasting blood sugar had dropped from 158 to 137. His doctor, at his next appointment, looked at his home glucose log and asked what medication he had changed. Joe told him, "I started eating eggs for dinner 3 times a week." The doctor laughed with genuine surprise, because we are simply not trained to think of food as having that kind of targeted, measurable impact on a specific number. But it does. One important note: if you are on insulin therapy, a change like adding high-protein evening meals can affect how your insulin works overnight. Before making this shift, have a conversation with your doctor. Tell them what you are planning and ask whether any dose adjustments might be needed. Good communication with your healthcare team is not optional. It is part of the strategy. Let me pull together the 5 most common mistakes I see people with diabetes make around eggs, because avoiding these alone will move the needle on your numbers. Mistake 1. Cooking in oil or butter. The egg already has its own fat. Cook it dry in a non-stick pan or boil it. Mistake 2. Pairing with refined carbohydrates. White toast, corn tortillas, biscuits. These undo the protein benefit almost immediately. If you want something alongside your eggs, choose half a slice of dense whole grain bread with visible seeds and eat it after the eggs, not before. Mistake 3. Drinking juice alongside. Even freshly squeezed 100% natural orange juice delivers a significant glucose hit with no fiber to slow it down. Eat the whole fruit if you want the nutrients. Do not drink the juice. Mistake 4. Throwing away the yolk. The yolk contains choline for liver health, vitamin D for insulin sensitivity, lutein and zeaxanthin for eye protection, and B vitamins for nerve function. People with diabetes need every single one of those nutrients. Eat the whole egg. Mistake 5. Eating eggs too late in the morning. Get protein into your system within 30 to 60 minutes of waking to dampen that early cortisol glucose surge before it builds momentum. Here is your simple, ready-to-use plan starting tomorrow morning. Wake up. Within 30 to 60 minutes, prepare 2 eggs, scrambled without oil or hard-boiled from the batch you made the night before. Pair them with half an avocado and a generous portion of any non-starchy vegetable. Spinach, tomatoes, peppers, mushrooms, whatever you have. Drink water or unsweetened herbal tea. Eat the eggs and vegetables first. If you want a small piece of whole grain bread, eat it last. If you need a mid-morning snack, 1 hard-boiled egg with a small handful of walnuts or almonds. That combination will hold you through to lunch without a crash and without a blood sugar spike. Aaron told me at his 6-month follow-up that for the first time in years, he was not afraid of his breakfast. He said, "I used to dread checking my blood sugar after I ate because I always knew the number was going to be high and I never understood why when I was trying so hard. Now I check it and I feel proud." That is what this is really about. Not eggs, giving you back a sense of control over your own health. Replacing fear with knowledge and frustration with a strategy that actually produces results. Your body is not your enemy. It has been doing its best with the signals it has been given. Give it better signals, the right protein at the right time, paired with the right foods, and it responds, sometimes faster than you would ever expect. Start tomorrow morning. Tell me in the comments which change you are making tomorrow morning. The cooking method, the pairing, the timing, or the evening egg strategy. I read every single one. If you know someone managing diabetes who feels like they have tried everything and nothing is moving their numbers, send them this video. Sometimes one piece of information arriving at the right moment changes everything. And as always, everything I share here is for educational purposes and does not replace the guidance of your personal physician. If you are on medication for diabetes, speak to your doctor before making significant changes to your diet. Your healthcare team needs to be part of this conversation. Take care of yourselves. I will see you in the next one.